Meniscal injuries usually occur at the knee when it's loaded, slightly bent and twisted. So avoid any activities where this may suddenly occur out of control, such as sports that involve sudden changes in direction. And when you're walking about day to day, a knee support could help prevent your knee from twisting. So let's have a look at 4 common knee supports that you could use. You may just choose to wear a simple knee sleeve. These are just made from thin elasticated material. You can probably pick them up from most pharmacies, supermarkets and convenience stores. And what they do is add a little bit of compression around your knee, so they won't really mechanically stop it from twisting, but they'll make you more aware of what your knee is doing, whether it's bending or twisting or how much force you're putting through it, simply because the squeeze from the material makes your brain more aware of what this part of your body is doing. If you're looking for very light support around the knee, I'd recommend using some kinesiology tape. Here I'm using some rock tape. Once again, I'll put a link in the description. But what you can do with this adhesive elasticated tape is wrap that around the knee and then repeat that on the other side. This is a simple application that you can do at home very quickly. Stick that down there, slight stretch and wrap it around the knee. So that still allows your knee to bend and straighten as much as you can. Just a couple more support options. You can also get these thicker knee sleeves that are often used by weightlifters, and they're made from a neoprene material, and they provide a lot more compression than that thinner material one I showed you earlier. So you need to make sure you get the correct size so that it's sufficiently tight enough, but also it fits. And then these do provide a lot more support around the knee, and you might find that this is something that you find beneficial. Some people find them a bit too tight and uncomfortable, whereas others feel that they give just the right amount of support. So there will be a bit of experimentation required, or maybe your therapist will be able to advise you or let you try on a few different options. It may also be a good idea to have a few different knee supports that you can wear when you're being more or less active. Now, one of the most comprehensive knee supports you can get is a hinged support. So this has metal hinges each side and also a hole in the front for the kneecap to stick out of to make it a little bit more comfortable. The extra support that these knee braces offer is usually compensated by a lack of mobility. You can see I'm struggling to bend my knee there because of the amount of material is simply stopping the knee from flexing. If I had a job that involved more knee bending, I think this would be really quite restrictive because it's uncomfortable even to bend it to 90 degrees. So even in the early stages of a meniscal injury, you want to try and keep your knee as mobile as possible, moving it in that pain-free range. So in physio, we often start with these simple heel slides, and we may advise that they put something underneath the heel so that you've got a gap under the knee, which then allows you to move it into a straight or even hyperextended position. This can often be difficult though if you sustained a meniscal injury. So now I'm going to show you 4 different techniques that you can use to help you improve the bending and straightening of your knee. Number 1, take a rolled up towel and place it behind your knee. Then bend your knee as far as possible until it traps the towel behind your knee. Then put your hands over your shins so you can bend your knee into as much pain-free flexion as possible. You can try increasing the folds in the towel so it provides a larger force behind the knee, and once again bending the knee into as much pain-free flexion as possible. The next technique is the twist. So start with your knee at 90 degrees and turn your foot out, and then help that rotation by twisting the top of your shin bone just below your knee, and then bend your knee up into as much pain-free flexion as possible. You can also rotate the other way, so turn your foot in to rotate your shin bone, and then increase that rotation a little bit with your hands on your shin just below your knee, and once again bend into that pain-free range. You can also do this into extension, so if you're struggling to fully straighten your knee, I'm going to show you another technique in a moment, but for here you can rotate, add that rotation in with your hands, and then move the knee out into as much extension as possible, or rotate in and move out into as much extension as possible. One of these might be really helpful at unlocking your movement or unlocking your knee. If you find that's the case, then remember that and use that technique on a regular basis should your knee get stiff or lock. You'll also notice I'm using the towel here to help my foot slide along the couch. Now this next technique is a secret technique that we often use in physical therapy if people are struggling to straighten their knee due to pain on the inside and towards the back of the knee. So if there's pain there when you're trying to straighten your knee, try this. Follow your hamstring tendons down to your knee and locate the painful point. Press 2 fingers in over that painful area and wait for about 10 seconds until the pain reduces. Maintain that pressure and then try to straighten your knee. What you can also do is, from that position, drag the soft tissue up towards you and then try to straighten your knee again. This may make it better, no different, or possibly worse. So therefore try with the press going away, pushing down the leg, and then straightening the knee to see if that helps. If it works, then perform 10 slow repetitions whilst maintaining that pressure. Now it's also important to keep the knee muscles working as well. Here's a simple exercise that you can do to start with, just simply bending and straightening your knee from a seated position. There's not much resistance here, just the weight of your lower leg. So to add some resistance, cross this leg over this leg by crossing the ankles over like so. And then that gives you a bit of extra resistance. So this leg is doing the work and it's just pushing the extra weight of this leg up and down. And you'll be looking to do about 10 to 15 repetitions of this 2 or 3 times. As soon as pain allows, I recommend that you start to do some body weight exercises such as these half range squats, for example. Now try to distribute the weight evenly through each leg, but if the knee is still sore, then it's okay to use the other leg a bit more, as long as you're putting some load through the injured side. And if you'd like to use a knee support when you do the exercises because it reduces the pain and allows you to put a bit more load through that side, then that would be a good idea. Now, as we get towards the end of this video, you may be interested to know that most meniscal injuries don't require surgery, and with just time and rehabilitation, you can restore full function of the knee. So just to recap, in this video, we went through the movements and activities to avoid, knee support options that you could use, movements and exercises to keep your knee mobile, and some strengthening exercises. Please do share this video with anybody else you know who may find it helpful. You've been watching the Physio channel. My name's Daniel Lawrence. Thanks for watching.